over the course of the last 120 plus years, there's been considerable evolution in what we understand by Chiari Malformation, and this has been particularly enhanced by the introduction of magnetic resonance imaging over 30 years ago, which has really given us an incredible ability to look at the structures, including the cerebellum and the cerebellar tonsils, in a non-invasive manner in living patients. In a Chiari malformation, what you can have to imagine is that in addition to having the medulla and upper cervical cord, or as we call it technically, the cervical medullary junction at the foramen magnum, you have the cerebellar tonsils crowding, and that is what the radiologists often use, crowding the medulla and cervical medullary junction at the level of the foramen magnum. This is the foramen magnum right here. And in so doing, they put pressure on the spinal cord, on the medulla, and interfere with the circulation of spinal fluid, or as it's also called, cerebrospinal fluid. Now, you also need to understand that in everybody, including patients with Chiari malformation, there is a normal pulsatility to the brain which coincides with the heartbeat. So every time the heart beats, there's just briefly a little bit more blood inside the brain, and the brain in that sense pulsates a little bit along with the heartbeat. If the brain pulsates, the cerebellar tonsils pulsate, and the present understanding is that it is this pulsation of the tonsils that project through the foramen magnum in patients with a Chiari malformation that drives fluid surrounding the spinal cord into the spinal cord itself, into the spinal canal, some people feel, producing a condition called syringomyelia, which is present variously in half to 60% of patients with Chiari malformation.